rich landscapes and diverse cultures and vibrant people. But behind all of that diversity, what many people don't know is that the continent's population tells a fascinating, albeit concerning, story about population change over the last 20 years. As I dug into this a little bit more, I realized that it wasn't just about the statistics and numbers. It's about real, serious questions surrounding how quickly the population is growing and what that means for stability in the future. One key issue that kept coming up over and over again was access to reproductive health care, particularly for women in sub-Saharan Africa. Right now, the lack of access is playing a major role in accelerating population growth, and that is creating challenges that just can't be ignored. So, for my honors project, I wanted to dive into a few big questions. How has Africa's population changed over the past 2 decades? What are the major concerns about where that growth is headed? And how does the healthcare gap affect everything? Why is any of this important? I've been analyzing data, studying research, and looking at trends from the past 20 years with the goal of understanding what's happening underneath the surface and why it matters. By exploring these patterns, I also have hoped to highlight some of the risks tied to rapid population growth, especially in terms of economic development. In the end, understanding these dynamics is absolutely necessary for the people of Africa to reach a smart and sustainable future. What I have here is a population pyramid, or a tool used to look at the age of the population in a given area. This one shows the population of the US as an example. It can be helpful because it visualizes different age groups and their sizes. Now let's take a look at the population pyramid for Africa. Today, Africa is home to about 1.47 billion people, almost 18% of the world's total population. So when you're looking at a population structure, you want to see different sizes of different age groups, right? So Africa is incredibly young. So around 40% of their population is under the age of 15. Over half the population, or about 54.8%, falls between the working ages of 15 and 60. But when you look towards the older age brackets, the numbers tend to drop off dramatically. There's a very small elderly population compared to the other regions of the world. Health disparities across the continent also show up when we look at life expectancy. So here you can see that the life expectancy on the continent ranges from as low as 25 years in some countries to over 79 years in parts of Northern Africa. These differences are closely related to healthcare access, living conditions, and overall development of the region. All of these are just statistics, so let's look at the story of a real person. This is a real woman, Susan Levy. She's a young girl from a small village in Sierra Leone. In 2005, she was born to a woman named Seta. Seta Levy was just 20 years old at the time. The people in her village described her as being full of ambition and a woman with a kind heart. It was, and still is, common for women to become mothers at such a young age. As you can see, in most sub-Saharan African countries, women often become mothers around the age of 20. Fertility rates play a huge role in this story. This graph shows that there's a clear relationship between infant mortality rates and fertility rates. So as fewer children die at a young age, families tend to have fewer children overall. Societal factors like female education, urbanization, and the availability of contraception also play a major role. This is a graph showing the rural versus urban fertility rates for Ghana, Kenya, and Ethiopia. And as you can see, women living in urban areas, especially in capital cities, tend to have much lower fertility rates than women living in rural areas. Education, especially for women, has a massive impact here. More education usually leads to smaller family sizes, which is important in managing population growth. So all of these components, the youthfulness of the population, healthcare inequalities, education gaps, all of it is tightly interconnected in this case. Understanding these is very important for trying to create sustainable policies that address Africa's current challenges while also tapping into its enormous potential for future growth. The demographic transition model offers a basic framework for understanding how populations change over time. It begins with the pre-industrial stage, where high birth and death rates keep populations low and relatively stable. This stage is unfortunately marked by hardship, famine, disease, and conflict. Today, there are no entire countries that remain in stage 1. However, there are isolated indigenous communities with little outside contact that would be examples of people in this stage. Following this would be stage 2, marked by a sharp population increase thanks to advancements in agriculture, sanitation, and healthcare. Modern examples of countries in stage 2 include Afghanistan, Pakistan, and much of sub-Saharan Africa. Africa's nations today primarily fall in between stage 2 and 3. So stage 3 is the post-industrial phase, or mature industrial. A lot of that sees a decline in birth rates because of improved female education, less child labor, and better access to contraception. Countries like Zimbabwe, Botswana, and South Africa are starting to transition into this phase, which reflects their important economic and social progress that they've made in the past few years. Now, a critical concept tied to the demographic transition is the demographic dividend. Computers are not working. So this is the economic growth potential that results from changes in a country's age structure. So like what we were looking at with the population pyramid, how that changes over time. Particularly when your working age population grows larger than the non-working age share. So a decline in child mortality rates often leads to lower fertility rates, creating kind of a bulge generation with a large workforce and few dependents. If enough jobs are available, this can result in rapid economic growth. However, the size of the dividend isn't automatic. It depends heavily on employee productivity and investments in education, healthcare, and job creation. Smaller family sizes also make it much easier for women to enter the workforce and for families to invest more in each child. So the term demographic dividend can sound like a really easy win, but in reality, achieving it takes a lot more of an involved approach. Education, healthcare, commerce, business development, and population policies all have to work together to create either virtuous or vicious cycles, depending on how it's managed. In sub-Saharan Africa, high fertility rates and youth dependency still create major challenges. Increased poverty, less investment in children, and reduced labor productivity and political instability are all current risks that they're facing. But there is hope. When youth dependency falls, even a small fertility decline can lead to immediate increases in per capita income. Strategic national planning is critical, including lowering fertility faster, strengthening financial systems, and promoting saving and investment on multiple levels. So to speed up Africa's demographic transition, strategic policies are going to be key, especially addressing public health issues like HIV and AIDS, childhood diseases, pregnancy complications, and malnutrition. Other focuses that are important are expanding education access for women, empowering them to make informed choices about family planning. Some of the ways that they've been doing this are providing systems like conditional cash transfers, which are just rewards for women's school attendance, essentially getting paid to get an education. And this has been very effective in boosting female education rates, which in turn lowers those fertility rates. Ultimately, achieving the full potential of the demographic dividend means investing in human development. So it's not just about reducing fertility, it's about strengthening our education, healthcare, women's rights, and workforce readiness. Africa's recent economic growth shows what's possible, but in order to sustain it, these countries must create high productivity jobs and support a rapidly growing youth population. And this is a quote from David Canning, who's an economist. He said, "Demography may be destiny, but countries can shape policies to ensure that this destiny produces a dividend and not a disaster." To understand the difficulty of accessing adequate reproductive health care in sub-Saharan Africa, we first need to look at the current healthcare landscape and the barriers that many women face. In a 2021 study, it was estimated that there are 251 million women of reproductive age in sub-Saharan Africa. However, a 2022 study found that over 57% of these women couldn't access reproductive health care. There are several barriers that limit access to this health care, like lack of education, insufficient funds for travel, and living in rural areas with few healthcare options. For people like Susan Levy, this became a very real problem when she found out she was pregnant in 2021 at the age of 16. Living in a rural area, she didn't have immediate access to quality health care or education. Susan is anemic, meaning her body doesn't produce enough red blood cells. When she was admitted to the hospital to deliver her baby, she was labeled as high risk. It's common for physicians in Sierra Leone to advise women to find their own emergency blood supply during their third trimester, because there's no guarantee that the hospital will have the blood needed to save a life at any given time. No one in Susan's family was able to donate to her emergency blood supply, putting her at further risk. In 2020, sub-Saharan Africa accounted for 70% of global maternal deaths, which you can see on this map. Most of these deaths would have been prevented with better health care. Many of them were caused by complications like preeclampsia, unsafe abortions, excessive bleeding, infections, and delivery complications. Like I said, many of these are treatable with the right care. In high-income countries, 1 in every 5,300 pregnancies results in maternal death. In low-income countries like Sierra Leone, that figure rises to 1 in 49. To be pregnant in regions like this is to be at the mercy of resource-strapped institutions and the global trends that are shaping them. Survival is too often put up to luck. Luck that a nurse or physician is nearby and that the government is paying them at the right time. It depends on luck that the medicine is stocked or that the blood bank has reserves. On the day Susan was born, her own mother died from losing too much blood. Her mother, Sarah, was 2 years younger than I am today. One key to reducing maternal deaths is to prevent unwanted pregnancies. Women, including adolescents, need access to contraception, safe abortion services, high-quality prenatal and postnatal care. Having these trained healthcare professionals present during labor and delivery can make the difference between life and death for mother and child. Early detection and treatment of these complications can undoubtedly save many lives. In many cases, women experience poor quality of care, such as maltreatment or abuse, along with shortages of medical supplies and undertrained healthcare workers. Additionally, social factors like poverty and lack of education disproportionately affect marginalized women, making access to quality care even harder. Gender roles also play a part, with women's health often being deprioritized, especially in certain cultural contexts. To tackle these issues, both the health system and society must work together to overcome barriers and ensure that all women have access to safe, affordable, and high-quality reproductive health care. Another pressing concern is the high rate of sexually transmitted diseases in the region. Sub-Saharan Africa bears 40% of the global burden of STDs, with an estimated 63 million new cases per year. STDs like chlamydia, gonorrhea, syphilis, and HPV cause over 300,000 prenatal and neonatal deaths annually. To address these challenges, better prevention and greater availability of contraception are critical, alongside expanding healthcare access and healthcare services, as well as improving education on reproductive health. To make progress in sub-Saharan Africa, the focus has to be on improving community involvement and raising awareness about reproductive health, STD prevention, and family planning. One of the keys to making these programs work is ensuring that they're culturally sensitive and available in local languages, so that way they reach as many people as possible. It's not just about the individuals who need the services, it's also about engaging cultural and religious leaders to encourage these individuals. These leaders can help shift attitudes and support the adoption of better practices when it comes to reproductive health. Beyond awareness, there's also a big need to improve healthcare infrastructure in sub-Saharan Africa. This means not only building and upgrading healthcare facilities, especially in rural and remote areas, but also having these buildings equipped with the right resources and technology to provide that reproductive health care. Strengthening the system also includes training more healthcare professionals and offering continuous education to keep them up to date on best practices in the industry. It's important that they also have supply chains that are reliable to get them the supplies needed during that. Another piece of the puzzle is advocating for better reproductive health care policies, which can be a lot more difficult. Countries need laws that promote equitable access to the reproductive health for all women, no matter their background or where they live. For this to happen, governments need to be held accountable for putting these laws into action. It's a tough challenge, but it's absolutely necessary. For people like Susan, these improvements have greatly impacted their lives. They allowed her to meet her healthy baby boy, Evan, and in the coming weeks, Susan got to do things that her mother never got the chance to. Feed her baby, rock him to sleep, wrap him in soft blankets, and watch him grow. So the story of Africa's population growth over the last 2 decades is about much more than just numbers or statistics. In doing this study, I've been able to highlight the region's young population, the gaps in healthcare access, and the significant differences in fertility rates. Additionally, I used the demographic transition model to help understand how population dynamics are changing, showing that there's real possibility for a demographic dividend if the right policies are put into place at the right times. To tap into this potential, I think it's important to address issues like family planning, healthcare accessibility, and cultural norms, as well as improving access to reproductive health care across the board. This is key to reducing the maternal and infant mortality rates, and for that, sub-Saharan African countries need to collaborate. They need to share research, resources, and best practices in the industry, in addition to improving healthcare overall. This study doesn't just answer questions about Africa's population growth. It highlights the deeper factors affecting the region's socioeconomic development. The hope for the continent lies in the demographic dividend, but to unlock it, there's need for a comprehensive strategic planning commitment. While demography may be destiny, it's proactive policymaking that can turn challenges into opportunities. Only through coordinated efforts can Africa overcome its demographic challenges and harness its growing population for human and economic development. The story of Africa's population growth over the past 20 years is one of complexity and potential. It transcends mere numbers. It speaks to the lives and the futures of millions.